If you feel pain when peeing, your first thought is likely a UTI. ONsalus Health explains the reasons for discomfort when infection is not the cause. Discomfort when urinating without infection can be caused by various conditions such as non-infectious cystitis, non-infectious urethritis, enlarged prostate, bladder or kidney stones, among others. Symptoms usually present as discomfort, burning, or even pain when urinating. They can manifest at any age and in any sex, although they are more common in women. We now explain the 8 most likely reasons why you feel pain when you urinate without infection. Non-infectious cystitis. Cystitis is inflammation of the bladder that may or may not be of infectious origin. When it is not caused by an infection, it can be due to a reaction to some medications, radiation therapy, or even substances that can irritate the bladder, such as personal hygiene products or spermicidal lubricant. Prolonged use of probes, the application of radiotherapy, or complications of other diseases may also influence this problem. Non-infectious cystitis presents with pain or burning during urination, frequent urge to urinate at night, and blood in the urine. How to treat non-infectious cystitis. Treatment will be based on symptom relief. The doctor will prescribe anticholinergic medications to help the bladder contract and empty, as well as muscle relaxants to reduce the strong urge to urinate. Non-infectious urethritis. Urethritis is inflammation of the urethra that can also occur due to an infection or can be of non-infectious origin. If it is not caused by an infection, it may be due to trauma, placement of a urinary catheter, or irritation from chemicals, among others. How to treat non-infectious urethritis. Treatment will also be based on symptom relief. Analgesics and anti-inflammatories will be indicated to reduce both pain and inflammation caused by trauma or an irritating agent. Bladder stones. Bladder stones are hard masses that occur when minerals contained in the urine accumulate and prevent their passage through the urethra. When a stone blocks the passage of urine, it causes the following symptoms: pain when urinating or difficulty urinating, increased frequency of urination during the night, cloudy or dark-coloured urine, blood in the urine. For these symptoms to occur in the urinary tract, it is not necessary to go through an infectious process. How to treat bladder stones. The doctor will advise you to drink plenty of water so that these small stones mobilise and may be expelled naturally. If they are too large, other procedures will be required, such as removal of stones through a small tube connected to a camera at one end so the doctor in charge of the procedure can see the stone. Its removal can be done through a laser, the application of ultrasound, or an instrument that breaks it into small fragments. Surgical removal is another procedure used to remove stones. This procedure will be performed in the operating room under anaesthesia. Kidney stones. Kidney stones are deposits of minerals and salts that accumulate inside the kidneys. These can affect any part of the urinary tract. Depending on the substance they are made of, they will be calcium oxalate, uric acid, or struvite. The presence of these stones may or may not cause symptoms. When they do so, we may experience intense stabbing pain under the ribs or in the back, which can spread to the abdomen and even the groin. Nausea and vomiting, blood in the urine. How to treat kidney stones. It will depend on the type of stone and its underlying cause. If the stones are small, the doctor will suggest drinking plenty of water, analgesics to relieve the pain, or taking some medications that may help the stones pass. When they are large, they will be symptomatic and require procedures where sound waves are used, such as extracorporeal shockwave lithotripsy. Through this procedure, the stone is broken into small pieces so they can be expelled from the body through urine. Or surgery in the operating room under general or local anaesthesia depending on the individual patient. You can learn about other symptoms of this disease with the video we share on the info card above. Benign prostatic hyperplasia. This is a condition characterised by an increase in the size of the prostate which occurs as men age. Although a natural process, it can cause problems when peeing, such as difficulty urinating, decreased force of the urinary stream, and the need to urinate more frequently. How to treat prostatic hyperplasia. Once the diagnosis is made, the doctor will prescribe medications that reduce the size of the prostate. If improvement is not obtained, surgical treatment will be recommended, such as transurethral resection of the prostate, which is the most commonly performed surgery. Urethral stricture. Urethral stricture is a narrowing of the urethra. It can cause discomfort when urinating without an infection. Urethral stricture results from scarring and fibrosis of the urethral mucosa. This condition can present the following symptoms when urinating: decreased urinary flow, difficulty or pain when urinating, incomplete emptying of the bladder, increased urinary frequency. How to treat urethral stricture. The treatment of urethral stricture will depend on the degree of obstruction. To do this, the specialist will initially recommend dilating the stenosis, either with the placement of a stent or by means of an endoscopy for resection of the stenosis. If this doesn't work, direct surgery for the stenosis will be required. If this video is helping to answer your questions, consider providing a super thanks to help our channel grow. Prostate cancer. Prostate cancer is the most common type of cancer in men. It is characterized by a slow-growing tumour which can remain restricted in the prostate for years without causing metastasis. When this tumour spreads into the urethra, it can cause obstruction and result in difficulty and pain when urinating, decreased urinary force, increased urinary frequency, blood in the urine, blood in semen. How to treat prostate cancer. If the diagnosis is made during the early stages, it is curable through the application of either surgery or radiotherapy. Advanced tumours without metastases are treated with radiotherapy, while in cases of metastases, drugs that block hormones such as testosterone inhibition are used. It's important to mention that this cancer has a poor prognosis when metastasized. Radiotherapy or chemotherapy. The application of treatments used in cancer such as radiotherapy and chemotherapy can cause discomfort such as pain, burning and difficulty when urinating, increased urinary frequency and abdominal pain. How to treat these side effects. The discomfort generated will disappear once the treatment cycles have been completed. The doctor will prescribe analgesics or anti-inflammatories to improve symptoms while the side effects of the therapy wear off. And this is our ONsalus Health video about discomfort when urinating without infection. If you want to continue learning about other ailments, don't miss the playlist we share here. Like and subscribe for more health videos to come, and we'll see you next time.